My name is Dr. James Amoah-Dankwah, cardiologist at Komfo Teaching Hospital. And concerning the feedback of the course, that is, I was offered postgraduate diploma in preventive cardiology, which I've successfully completed. The feedback about the course was very instructive and educative. Based on the course contents, that we dealt a lot on the hypertension, dyslipidemia, coronary artery disease, and other things. And also, we also dealt with the negative impact of other diseases on cardiovascular diseases such as diabetes, obesity, alcohol, cigarette smoking, nephrotic syndrome, chronic kidney disease. And upon completion of the course, that's my achievement after the completion of the course. The course has been very, very beneficial to me, and it has impacted positively on my practice. Ghana being a third world country, we can't afford the management of cardiovascular disease as is done in the Western world. So prevention is one of the things that has helped us a lot. And I've realized that since the completion of the course, some of the things I learned, putting it into practice has helped a lot of my patients. And the readmission rate for cardiovascular diseases is going down, even though we haven't yet done empirical study to establish that fact. But on our day-to-day interaction in the ward, we've realized that patients who used to come for regular readmissions, we don't see them very often these days as opposed to the past. And this is all because the course taught us so many things about the preventive aspect of cardiology, like reducing weight, smoke cessation, reduction in alcohol, screening procedures. The screening procedure we've realized is that, especially with the coronary artery disease, ischemic heart disease, if you're able to see the patient earlier, then you'll be able to tell who is likely to have ischemic heart disease or coronary artery disease by doing CT calcium score and then CT coronary angiogram. When we embark on this project, it has helped us a lot to pick the patients who are likely to have this problem in the future and managing them very well. It has helped us a lot. We believe that with time, coronary artery disease and ischemic heart disease will go down considerably in our environment, and this will impact positively on our cardiovascular practice, because preventing these diseases is far cheaper than managing them, since we don't have all the things in place to manage such patients. So going on the preventive pathway is going to help us positively to reduce the cost of management of cardiovascular diseases. And also organize regular and periodic training for my other doctors on preventive aspects of cardiovascular diseases. That's the benefit we are having in our environment. And a lot of them also are picking it up, because some of the things people were not considered as very important is now coming up. For example, you know, women are very fanciful of chocolates. And these women, you put them on statins and they will come and you realize that they are not able, their cholesterol or their lipids profile is not going down. And when you probe further, you realize that they eat a lot of chocolate. So we advise them to go for dark chocolate, even though it's not tasteful as opposed to the white chocolate. But when you educate them and let them know the benefit of that chocolate, if they cannot stop the chocolate altogether, and they pick it up, you realize that their cholesterol or their lipid profile is improving. And also advising them on alcohol intake and also cigarette smoking, advising them and also to reduce their weight. It has helped us a lot, and it's in fact improving our cardiovascular practice in our hospital. Our long-term plans is to extend this program to other hospitals in our region and also beyond our region, because even though we are my hospital is a teaching hospital and it's a tertiary referring center, it's not everybody who will come to us. Some of them may not come to us altogether, but we believe that when we expand this teaching program to other hospitals and other regions, is going to help Ghana as a whole, as a country, to reduce the cost or the burden of cardiovascular disease in our environment. So these are our future plans, which I have discussed with some of my colleagues, and also with Ghana Society of Cardiology, which will try and expand this program beyond our region to other regions, and that is going to help to reduce the burden of cardiovascular disease. And I won't hesitate to refer my other colleagues to Merck Foundation to embark on this course, because this course is very, very helpful. And I thank Merck Foundation very much for giving me the opportunity to embark on this course, which has impacted positively on my cardiovascular practice in my hospital. And it's very, very, very helpful. And at times when you go for conferences in Ghana, my inputs, people take it very seriously because they know that what I'm saying makes sense. And I got to know some of all these things because of the training I had, or the opportunity Merck Foundation gave to me. So I thank Merck Foundation very, very much, and I recommend to my other colleagues to contact Merck Foundation to embark on this preventive cardiovascular course. Thank you very much.